Welcome to My Conversation, a presentation of KAIL-TV My Central Valley. So let's get My Conversation started.
And welcome once again to My Conversation on My Central Valley right here with Feather the Wise, right back at you. It's kind of become a regular thing here, but let's get off into the show. We got a great show lined up for you tonight, but right now our first guest, right? And please put your hands together for Dennis and Christopher Shamlian of Shamlian Dental Incorporated.
Thank you.
Now, this is not deja vu. I'm not seeing double right here. This
was coordinated on purpose.
You has to be the only matching coordinated dentist in the valley, man. Now, your office, tell me exactly what do you do? What services do you have in your office?
We do general dentistry. Been doing general dentistry since 1980, but our niche is emergency services.
Yes.
24-hour emergency services and weekends by appointment. Most of our emergencies are broken teeth or abscesses, toothaches, repairs. We got a lab on premises, but we've been happy to serve the Central Valley and Fresno since 1980.
So in the middle of the night after I've had one too many and I take the mug and crack it against my tooth, I can give you a call.
That's right.
Yeah.
So what you doing tomorrow?
No. Yeah. The interesting thing about emergency dentistry is that there are a couple things that prevent people from just coming in. You know, whether that may be anxiety or finances, or just misinformation about what procedures or treatments are available to them. So that's what we're trying to do here, is just bring a little bit of awareness to kind of what emergency dentistry entails. Like my father was saying, everything from a broken tooth to an abscess or an infection. I guess one of the most important things is to just make the call. Find somebody that you trust.
Right.
If it's not your regular dentist, then give us a call. But it's to get in there and get something taken care of, because it's not going to get any better.
I see these guys, you can tell they know exactly what they're talking about, and I'm not just siding with them because they are one of the sponsors of the show. Just want to make sure you know that. Now, what are one of the fears that people have? What is the main fear that people have about coming in? Is it the needle? Notice I did the needle, or is it just that, or just the pain that they think they'll have?
It's a preconceived notion that they're going to have discomfort because they either heard something from somebody else or they had a bad experience in the past or as a child. Mm-hmm. So a lot of that we have to help them work through or undo with a good experience. It takes several good experiences to build confidence.
Right.
Yeah, so that's how we do it. If they have anxiety, we offer sedation. They can bring a ride in and we can get them comfortable. We don't push anything on a patient if they're not prepared for it. Basically just getting to meet us the first visit. If they want something done the first visit, we can do it. But they come in and they meet us and see, it's family dentistry. I practice with my son and my daughter, and we've been here since 1980, like
That's
I said,
awesome.
and so we just we take care of the valley's taking care of us.
That's awesome. So
Just having that space available to them to come in, kind of see the facility. It's a beautiful open-aired, modern facility. It's very much unlike the traditional closed-off, dark.
Take you back in the room.
Take you back at the end of the hallway.
Leave your folks at the end. You hear crying at the.
We've got vaulted ceilings, and a lot of the operatories are very spacious, and so the patients feel like it's less of that clinic mentality and more of a high-end medical office is what we're going for. And even seeing that helps alleviate some of the anxiety. But if it gets to the point where we need to give you something, it's oral conscious sedation. You take a tablet and it takes the edge off. A little bit of that fear is taken away, and it makes it easier for you to get through the appointment. Make the experience better.
When the patient comes in and on a one-to-one basis with the doctor, there's a bonding.
Yeah.
Instead of getting in a situation where there's 5 or 6 other people there, 5 or 6 other patients there at the same time. So when they do come in on the weekend or after hours, it's the dentist and the patient and the family, and then they get the personal care that they need for whatever their needs or their requirements are. Makes it easier for them.
I can tell you right now, I need some work. And outside of your regular sedation, I'm going to need a couple of things of tequila on the side to take the edge off.
That shouldn't be an issue.
Now, what is some of the advice for home care and recommendations for treatment?
Well, basically, prevention is where it's at.
Right.
Realize that when you have a little problem, it's easy
and
it's cheap to fix. When you bring a big problem to the dentist and expect him to work a miracle, you know, then it's a harder thing and it's more costly. So my advice to everybody is take care of your teeth, brush and floss them, take care of your kids' teeth, brush and floss them, and get them in for preventative exam. Exams are easy. We used to do a lot of exams in the schools, you know, get them in when they're real small and try to see if there's any problems before they become a big problem. But that's the key.
Yeah, I'm doing a dental screening at my daughter's school, the Charlie Kane Armenian Community School over in Herndon-Villa. We're doing a dental screening for the kids there on Thursday. And it's just having a set of eyes in there and just verifying and making sure that nothing's going to crop up and making sure that they know that they need to improve or they're doing great on their oral care at home. So just ounce of prevention, right? So
now a lot of times people got these life hacks and stuff trying to get their teeth white. I'm assuming that you guys are against gargling with bleach. That's not gonna.
Yeah, it doesn't. It's not linear like that. Unfortunately, that's not the same type of bleach that they're talking about. What we're using more now in dental terminology is whitening, because we're basically using detergents to remove the surface stain. Most of the time that gets the results that you want, but when we're talking about people who are looking for deep whitening because of issues with the way their teeth developed or something inside the tooth, there are very few options other than restorations that can be done over the top of them or a newer whitening agent that actually goes and permeates deeper into the tooth structure. But yeah, the coconut oil pools.
Everything.
No, it's not going to work. I'd like to see somebody show me that actually worked.
Don't treat me like a stranger when I walk through the door.
We won't.
Now, specific location. What cross streets are you located at?
We're at West and Herndon, on the northwest corner, just north of Walgreens and Premier Bride.
Okay.
It's real easy to find us.
Yeah. Now, is there a website they can get on? Yeah,
absolutely. You can go to dentistry24hours.com. So it's real easy to find our information there about the hours of our operation, regular hours, and also phone number to reach us at would be the 559-438-4646 number. And you can just Google us, Emergency Dentist Fresno. You'll see there's a reason why we're #1 in the Valley. It's because we make ourselves available to our patients, and my father's been doing that since before I was born, so it's true.
You got it right here, man. It's not just the twins that's working on you there. You go in, it's a family field. You go check them out. Dennis Shamlian and Christopher Shamlian at Shamlian Dental Incorporated. That's Emergency Dental. Check them out in Fresno. I know I'm going to be there. Hopefully you'll be there too. Don't go anywhere. We'll be right back on My Conversation right here on My Central Valley.
This episode of My Conversation is sponsored by Shamlian Dental Inc., offering 24-hour emergency dental care.